good afternoon, everyone. I'll just share with you very short. My presentation is just only about 6 slides. And we are looking at innovation from a very different perspective, and you will know later. I'll just start by thanking the Asia Cruise Forum Jeju for organizing this physical meeting and for inviting us to speak. And I will begin by sharing a little bit of Singapore's cruise resumption journey. Singapore rolled out a phased approach to cruising, so we did a step-by-step approach as well, with innovative solutions and rigorous safety protocols. So since we started in November 2020, we have processed over 600,000 passengers and have done more than 400 sailings. There have been very positive public sentiments on cruising. The session before that, we were talking about how to convince people, with the outbreak on cruise ships during COVID. But what we found, the silver lining out of COVID is when we started cruising, we managed to convince many people on the safety of cruising, and we've won many, many first-time fans who would otherwise never have chosen cruise to be a vacation option if not for the fact that borders have closed. So the other thing that we want to say is also the fact that there was very little COVID positive incidence rate, or rather I'll put it as COVID cases arising from the cruise sailings. Of course, if you have a lot of community cases, some of them would have gone on the ship. But community cases, because of cruise sailings, is very, very low. In fact, I'm very confident to say hardly anyone, because the sailings are very, very short, hardly any of the cases that we see on the ship is due to the cruise sailing. It's more of them bringing the cases on board. But all in all, when we count, the COVID positive incidence rate is at less than 0.1%. And so it's a very, very strong testament to the tight protocols, the containment measures, and overall emergency preparedness on board. Well, recently, in July, we managed to convince our regional partners, Malaysia and Indonesia, to come aboard to allow cruising from Singapore to the regional ports, so that we are done with cruises to nowhere. At least we are going cruises to somewhere. Thailand will open up very soon as well for cruising. And we're very happy that come Q4 of this year, there won't be any need for approvals from the Singapore government to sail. So we are expecting many ships to come back to our port. And a few days ago, while we were here, I believe that there was an announcement to say that in Singapore, we have further streamlined our safe management measures, so there won't be any need for indoor masking anymore. You can walk around without wearing mask, except if you are in a public transport, and cruise is not a public transport, or places where it's vulnerable setting like the hospitals. So we are in a good time for cruise resumption to fully happen. Okay, so I put the 3 innovations that have been driven by COVID. I have 3 examples to give, and then the first one is on Ops Gem Dom. So we call it Operations Gem Dom because the ship was Gemini first, before we used Aquarius. And Gem because we made a story out of cruise ships, that from Petri dishes, they can be gem for the government when we need them to come in to support a national effort. So Ops Gem Dom was an initiative that was led by Singapore Tourism Board to support the national effort in managing the COVID-19 outbreak in foreign workers' dormitories, and it freed up space at community recovery facilities for those who require medical attention. We had Superstar Gemini and Superstar Aquarius, both of which, as you would know, sometime in March, the whole industry has come to a standstill. All the ships were in layup. So what we did was to revive cruising in some ways by bringing back these 2 ships into operations and converted it as alternative facilities to accommodate over 8,000 recovered COVID patients of various nationalities. In preparation for Operations Gem Dom, STB collaborated with many parties, with the terminal operator, with the cruise lines, with various government agencies to develop SOPs, emergency response protocols, and so on and so forth. What we did was we appointed the terminal operator who was in charge of bringing in this recovered patients to do their registration, to do their check-in, And also, within a very short time frame, a command center, check-in and check-out operations, full medical facilities were set up at the Marina Bay Cruise Center to support this whole effort. We had sick bay that was constructed, we had tentages and barriers serve as isolation stations. Now, this is not what we want for the cruise industry, obviously, but when the cruise industry was at a standstill, I think this is the best that we can make use of the supply that we have to then reverse perceptions of cruising being a dangerous product. And that was a very tiny step, but it was a very, very significant step. So despite Operations Gem Dom as being a very unprecedented initiative, we were starting from a blank slate. The project was recognized as one of the most organized alternative facilities for recovered workers. The second innovation that we have was Operations Recruise. We love to call our operations here and there because it just gives a sense of importance, but it was. So Operations Recruise was against a backdrop again of concerns surrounding cruising during the pandemic. So what Singapore Tourism Board did was to reimagine the entire cruise experience. And we worked with many government agencies and cruise lines on a range of measures in preparation for cruise pilots. So we brought in many firsts. For example, we had the first pre- and post-cruise testing. We set up the car park of the cruise terminal into a COVID-19 test site. And in total, we facilitated over 400,000 tests in the first year or so of cruising. We use contact tracing devices as well to monitor behavior of cruise passengers and crew on board, and to collect data to ensure there's compliance of safe management measures. We also had tabletop and simulation exercises. As what we said, the technical calls earlier this morning, it was really to test the processes that we have designed. At one point, when I was calculating the number of people who was involved, there was easily more than 10 government agencies and teams, and more than 100 government officials all in the same place as the cruise lines, saying that, okay, this is the way to go, how do we solve the problems? The third innovation that was driven really by COVID was cruise safe certification. So to restore consumer confidence and demand for cruise at a time when we really suffered from negative perceptions, STB had to quickly think and rethink the processes that we had in order to allow cruising to resume. So we worked with DNV, which is a global maritime expert, to conceptualize and jointly develop the world's first cruise safe certification from a port. And cruise safe certification incorporated global safety and hygiene standards from the World Health Organization, the IMO, and CLEAR, and as well as the national protocols that needed, that was required to be complied with at that moment in time. So cruise safe certification, in short, it really tests the readiness of the cruise ships in 7 key areas, like 100% fresh air circulation and infection control measures, so on and so forth. So these are the 3 innovations that were driven by COVID. Now we want to talk very quickly about 3 factors that supported innovation. Innovation sometimes is not just like the latest or the biggest technological innovation. It's really about rethinking processes. It can be very small, but yet they could be very significant. So we just wanted to share 3 things that we felt defined how Singapore started resumption successfully and what were the innovative aspects of it, or rather the factors that contributed to the innovation that came out of it. The first was really teamwork. There was tight coordination between government agencies and the cruise industry to rally for support and to come with for swift execution. The second was creative problem solving. So unprecedented times obviously required unprecedented solutions. We cannot think like yesterday. We had to really look at, we were starting on a blank slate. We had no processes, no references to follow. Together with the cruise lines, we sat and we brainstormed on what are the measures that could work. We had many, many iterations, and that goes to the third one about agility. We had many cycles or circles of design. We developed, we tested, we launched, and we feedback. An example I can give you was when we started, I remembered the first cruise was somewhere on perhaps, I think, early November. And on 1st of November, we went up to look at the ship, and we did the first testing ever. So all of us said that pre-cruise testing was important. It has to be PCR, but none of us had ever been PCR tested. And so when our ministers went up, we had to make sure they were PCR tested as well. and everybody realized how painful and how uncomfortable it was. And the cruising was going to start in 2 days' time. And we concluded that, PCR doesn't work. It's not going to work for the families, it's not going to work for the children. And so over the next 2 days, we had to work with the Ministry of Health to acquire hundreds of thousands of ART kits, the antigen rapid test kits, to replace the PCR kits. It was a huge endeavor because we would already have made orders for PCRs, and now we had to convert them to ART use. So there was a lot of creative problem solving and agility that was needed. And going forward, what are the 3 areas of focus? I think I always say we don't want to waste COVID. And what ahead now for the cruise industry? The first is really about technology, learning from COVID. I think we all recognize the importance of contactless technology at cruise terminals and how we can improve immigration clearance time, but at the same time, meet hygiene factors. Green tourism, for example, so we collaborated with the cruise lines, or rather we are working continually to collaborate with the cruise lines to support sustainability initiatives. And this is very aligned with Singapore's Green Plan for 2030, where we want to promote the use of low-carbon alternative or net zero emission as well. So we are looking at our logistics, our supply chain processes to reduce carbon footprint in general. And the third, it's really about infrastructure. It's very, very important. I give you an example of Singapore's Changi Airport, which I'm sure many of you would be very well versed with. So during the 2 years where airports were closed, Singapore's Changi Airport Terminal 5 project was also put on hold. And we used this time to really to have a comprehensive review and refine our Terminal 5 design, and to see how we can make it more modular and more flexible to enhance resilience and sustainability as well. And all these were lessons that we learned from COVID. So now we have decided that Changi Airport Terminal 5 is expected to have more plug and play, where spaces can be easily converted to accommodate testing centers when we come to another pandemic. We know this is not going to be the last pandemic, but we want to make sure we are well prepared for the next. And so similarly, we are looking at adopting some of this creative use of space for our future cruise terminals as well. Even currently, the design of the Marina Bay Cruise Center allows for shutters at the immigration hall to be rolled down to cater to varying ship capacities, facilitating segregation of arrival and departing passengers. We have a mezzanine that we are able to segregate for dedicated check-in area for selected cruise passengers to potentially minimize intermingling. And so we are looking at modular construction techniques as we look at future cruise terminal designs as well. So by continually improving our capability and future-proofing ourselves, we feel and we are confident that we can remain relevant and ready for an unpredictable future ahead. Thank you.